It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, Fiat Chrysler Automobiles in Kokomo, the first domestic automaker in the nation to establish a near-site health clinic. FCI joining a growing business trend. 30% of large U.S. employers have created health clinics. Business of Health reporter Kylie Veleta has more in the Business of Health. Kylie.
Thank you, Gary. There are 5 Fiat Chrysler plants in the Kokomo area, and together they make up one of the largest automotive transmission complexes in the world. Keeping those thousands of employees healthy is a massive task, and that's why FCA changed its strategy and opened a near-site clinic. The transmission maker partnered with St. Vincent to open the Family Health and Wellness Center in Kokomo. Dr. Michael Busk, medical director of the St. Vincent Health, Wellness, and Preventative Care Institute, joins me now to tell us more about the project. Thanks for being here.
Thank you very much, Kylie.
We were just talking about this, 22,000 people. That's how many the FCA employees and their families, that's how many this clinic serves. It's been open about 3 months now. How did FCA and St. Vincent come to partner on this project?
Very important question. Sergio Marchioni, the former CEO and chairman of the board, said, I have control over every aspect of building an automobile instead of health. Mm-hmm. And I sent the CFO's office, the comptroller, and the head of benefits, Jim Godot from the CFO office, and Kathy Neal from the HR office, to go down to Kokomo and find a partner to help us by improving the health of our employees and lowering the spend. They met with Margie Johnson, who's the president of St. Vincent's Kokomo, and Margie Johnson said, we're with you, we're going to work with you, and we'd like you to visit our worksite clinic at Carmel Clay Schools so you can see our operation and we can scale this to the model for FCA.
And this model is growing, these near-site clinics. 2 key selling points. It saves money and it improves employees' health. So tell us how this model accomplishes those 2 things.
In our model, it's a person-centered home for healthcare. We have a one-stop shop for healthcare, in which we have doctors, nurse practitioners, nurses, MAs, but we bring in the lifestyle aspect and the behavioral aspect, because 40% of our deaths are due to behavior, lifestyle. 80% of our morbidity or chronic disease is associated with lifestyle. So we not only have all the medical to take care of the patient and their families, but we also have behavioral health clinic. We have healthcare navigation, which is critical, exercise physiologists, dietitians, radiology center, physical therapy, wellness directors, exercise classes, pharmacists for PharmDs. Especially the PharmD works very strong on chronic disease management, and we're all focused on the patient.
And 40% of FCA employees prior to this clinic did not have a primary care physician. So they were visiting ERs and urgent care clinics instead. So this model also really focuses on personalized care.
Absolutely personalized care. We spend a lot of time in the recruitment process. We want high customer service, employees with great personality, because I am a scientist, but I'm going to tell you, it's the art of medicine, because we are helping people to improve their health and empower them to take care of their health. And more than anything else, what this does is increase access, easy access. In our first month, 750 people that came in the first month, 95% did not have a primary care doctor.
So as more employers want to adopt this model, is it becoming a big focus for St. Vincent, a new focus?
It is absolutely a big focus. I report directly to the CEO, Jonathan Nally, and I meet with the Chief Operating Officer, Cheryl Harmon, every 2 weeks on this project. It's an important project, and I would quote Jonathan Nally by saying, Dr. Busk, your goal is to improve the health of the company and lower their spend.
All right. Well, thank you so much for being here and telling us more about this model. Gary, back to you.
Thank you.